Last month, we worked with our local sheriff's department to help rescue a terrified horse that had been shot with a rifle by his previous owner. We found out that this horse's name was Hannibal, but after settling in at our sanctuary, he was blessed with the name change to Samson. The nerve damage from the bullet that ripped straight through the center of Samson's neck caused him to become paralyzed on the right side of his face and gave him a corneal ulcer, which caused him to go completely blind in his right eye. Thankfully, we were able to stop the spread of the paralysis through steroid intervention, but the damage that was already done was irreversible. The right half of his face will remain paralyzed forever, and despite all of our best efforts, we've worked tirelessly to try to help rehabilitate him. However, without being able to blink, he can't keep his eye lubricated enough, so his eye has now started to dry out and shrivel up. Once this process begins, it is extremely painful for him, and if we left his eye alone, it would continue to shrivel and eventually would rupture, causing a dangerous and even more emergent situation than he's already in. So we made the decision to rush him to our incredible veterinarian to do an emergency enucleation procedure where he will be getting his eye removed. Our vet was gracious enough to explain the entire procedure step by step for all of us so that we know exactly how this process is going to go.
Samson's gonna have his enucleation today. Unfortunately, with the facial paralysis he had, he is not capable of blinking in his right eye. This is causing his cornea to die, which will eventually, the eye will ultimately rupture. So we're gonna go ahead and take that essentially dead eye. Enucleations is what we call the removal of the eye. That procedure can be standing or laying. Laying a horse down is always dangerous in terms of will they do it gently? So we are gonna do our standing procedure for him today. We stand them in our stock barn, which is that blue barn behind him, and he will rest his head on some cushions while heavily sedated. We numb the nerves behind the eye. There's a big optic nerve that allows these eyeballs to work, and then we basically go in and we will remove the 12 ligaments that hold the eye in place, tie off the blood vessel, hold some pressure, and then suture the eye shut. So when he gets home, he'll have a wrap on his face for about 48 hours, and then when you take it off, the eye will look flat, and then as it heals, it will eventually sink in.
Samson spent the night at the vet so that he could be in a sterile environment and monitored for the first 24 hours. Now he is finally home and recovered. In 2 days, we will remove his wraps and he will officially begin his new life here in Sanctuary. Samson still has a long road to recovery ahead of him. Learning to adapt to his new life will take time, and learning to forget the trauma from his old one will take even longer. But Samson will spend the rest of his days in peace and safety with the rest of our herd that we can't wait to introduce him to, his own little family here at our sanctuary forever.